Hi, everyone. My name is Mark Cooper. I'm the president and CEO of the Saskatchewan Construction Association. The interview you're about to watch is the first in a series we're doing where we're talking with leaders from across Saskatchewan about topics that are of interest to you, our viewers. Today, backed by popular demand, my guest is Dr. Ross Findlater. Dr. Findlater is a former Chief Medical Health Officer for the province of Saskatchewan, and he's currently working to support Dr. Shahab, the current Chief Medical Health Officer, and his public health team. So welcome, Dr. Findlater. Thank you for joining us. And can you tell us a little bit about yourself and your background? And I'm curious, why did you choose to become a doctor, and specifically, why pursue public health?
Yeah, I can't really remember why I chose to become a doctor. It was a while ago. So I think it looked like it was going to be interesting, interesting work. Yeah, I've got first I was a real doctor for about 15 years. I did emergency medicine or primary care. And got a chance to work internationally for a couple of years of that. And then I went into public health medicine specialty training, and I've been doing public health medicine for the last roughly 25 years. You mentioned I worked a little bit, I worked for 6 years at the ministry as the Chief Medical Health Officer, but I've worked in a number of other health regions, areas around the province. In the last 5 years, I've been doing a mixture of contract work, some of it internationally and some of it in Saskatchewan.
And
so a couple of months ago, I decided it'd be more interesting to actually work on the COVID response rather than listening to it on the news all the time. So I called up the ministry and asked them if they wanted a bit of support for a couple of months. So, yeah.
Excellent. And you've worked with Doctors Without Borders before, and you worked in other situations dealing with other viruses and outbreaks like this, as I understand. So from your perspective, how's the world, and maybe specifically Saskatchewan, doing in terms of dealing with COVID in comparison to some of your other past experiences dealing with other types of outbreaks?
Well, there have been some good things and some bad things, I guess. I think it's a more serious global infection than the other ones that we've had to face here in Saskatchewan. I mean, we've had pandemic influenza go through. In Canada, we've had SARS, but we never actually did have a case of SARS in Saskatchewan. Most was in Ontario and Columbia at that point. I think one of the things that's been quite good is the sharing of information. I remember even in 2004 when SARS-1 came around, it was a real problem that different countries weren't willing to share information, and researchers weren't willing to share information because they wanted to keep it for publication. Right now, China apparently, from what we can see, has been a lot more open than they had been in 2004, and has been sharing their data and their research right from the start. And if you're a medical professional, rather than research taking months to years to get published, it's being published almost immediately online in a version that's not finalized, but is very useful for making decisions. So I think a lot of that's good. I think the bad part is it's more serious a problem than we've faced before. We've had a pretty easy time in Saskatchewan compared to some other provinces. But the overall problem is a lot more serious than the other respiratory viruses we've had to face before. Yeah, I think the other thing that's bothered me is for these less serious diseases, there was more international cooperation. I'm saying that information is shared quite freely. But it's been one country against another a lot of the time, and considering it's a global problem and a global solution is the long-term answer to this. It's really it's been too bad that we've had country against country so often in this response. Anyway.
So well, let's talk a little bit about the progress of the virus so far, because as I understand it, globally, the number of positive cases is still growing on a daily basis, and so it would seem to me that we're still somewhere globally in this first wave of the virus. So, from your perspective, what can you tell us about where we are globally with respect to the virus progress, and what we can expect maybe here in Saskatchewan over the next 6 months? So between now and Christmas.
Yeah. Well, yeah, it's been making its way across the world, really, having started in China. And now China is mostly worried about imported cases from other places. Then it's spread across, well, we know of a few countries, got to Iran on the way to Europe, and caused a lot of problems in a number of European countries. I mean, Italy and Spain and now the UK were probably the three hardest hit there. Then after that, it got to North America, the US and Canada, and I think the growth area for it is right now is in South American countries. So, I mean, that's often the pattern with respiratory viruses is they work their way around. This one's just done it a bit more quickly, perhaps, than some others, and with kind of higher consequences. I think one of the unknown areas is what's happening in Africa. I mean, there's numbers there, but they're probably not as good as we have from other places. Yeah. So, I mean, we haven't done, we haven't really had a big problem in Saskatchewan, although the North had a big problem and still has a number of cases every week. We're fully expecting that Saskatchewan will have a more serious run at this virus at some point. Typically, respiratory virus season is from sometime in the fall, September or October, sometimes a bit later, and lasts until March or April. So there are still a lot of unknowns about this virus, but we're expecting, if we're able to have a fairly calm summer, then we should be planning for a more problematic fall.
So let me ask you about that then. I think to some extent there's this public relief of, okay, things are better now, maybe we're done with this. And so we're seeing larger gatherings. Over the weekend, we saw some big public gatherings with respect to public protests and a few things. And just wondering what your sense is and what words you would have for people in terms of the fact that we're not done with COVID and we're not going to be done for some time.
Yeah, it's living the last couple of months is not fun, and it's not a good way to live long term. I mean, social relationships are very important for people. On the other hand, sort of mass gatherings are one of the most effective ways for the virus to spread around. And the plan on reopening Saskatchewan is an attempt to let the rules off in a way that seems safe and won't result in a sudden explosion of cases that our healthcare system can't handle. So that's why the Reopen Saskatchewan plan builds in a series of steps, including going slowly on the mass gatherings. I think the third phase of Reopen Saskatchewan, which would be the current set of rules, limits indoor gatherings to 15 people or outdoor gatherings to 30 people. And there's a bunch of rules for different kinds of businesses about, how they can reopen safely. On the other hand, I mean, it's hard to know what, certainly we were pretty nervous when the Black Lives Matter demonstration was starting to be organized in terms of, is that going to be a big problem or not? people did seem to be wearing, a lot of them were wearing masks, and they were a bit more spread out than you would have, found in something similar a couple of years ago. So I think people were still trying to be conscious of trying to prevent the spread of coronavirus around. So, and it also seemed to fill an important social need.
Mm-hmm.
So, yeah, as a public health professional, it kind of makes you nervous, but also it was important for people to be able to express themselves about that issue. If it was to lead to lots of big gatherings in the summer, if people feel like there's no need to worry at all, I think that would be a bad outcome. Mm-hmm. Even though for right now, the cases have been dropping down and in a very reassuring pattern, even in the north. It hasn't gone away from the world, certainly, and there's a circulation of a small amount of it here in the province. So I think people should be thinking that the future is going to have to keep thinking about coronavirus at least until next summer, 2021. They have to figure out how to modify behavior in a way that decreases risk. Mm-hmm. I think people in Saskatchewan generally have been very cooperative with this. I think it's been very hard for everybody to live in such a restricted manner.
Right, and the message is, even though some of those restrictions are lifting, the caution, the vigilance, the basic habits of social distance or physical distancing, cleanliness, hand washing, sanitization, those things are with us for a while.
Yeah, that's the basic message, and we hope, going into this, the rules were imposed very quickly, mm-hmm. in a very authoritarian way. Mm-hmm. And by lifting them gradually and evaluating what's happening, we hope to be able to figure out what are the most important means of keeping us all safe. But we'll have to see. That'll take a while.
Mm-hmm. So let's talk about a vaccine. Is it, would you call it probable that at some point we will have a viable vaccine?
Well, if we don't, it'll be quite stunning. It's been the vaccine response or immunization response has been quite remarkable. The virus was sequenced, so there's a detailed analysis of the virus within a couple of weeks of it being identified back in January. And the Chinese researchers who did that circulated to researchers around the world without any strings attached, so that vaccine development could start up right across the world without having to wait longer. So there's quite a pipeline of vaccines under development using different techniques. It would be hard to believe that there would be big numbers of or large amounts of vaccine short of a year from now, I guess. There's some that are in early stages of clinical trials. And there's so many different vaccine technologies that are being considered that it's hard to believe that a couple of them wouldn't prove to be quite effective. But we have to wait and see, basically.
And as I understand, the stuff I understand about vaccines can probably fit into a syringe itself. But my understanding is that we're not likely to find just necessarily one vaccine or one vaccine that will work for everyone or all types of the population, and so it's likely to be some kind of combination of vaccines. Is that accurate?
Well, there are probably different vaccine technologies will work against the same virus. That's been the usual pattern. So some of them are working with pieces of protein. Some of them are working with pieces of RNA, the kind of genetic code from which proteins are created. And some of them are working with weakened versions of the virus. And some of them are taking another virus and adding a piece of the current coronavirus onto it. So there's quite a variety of technologies being used. So my expectation would be that more than one of these will be able to produce a good immunologic reaction and protection. But they're all in early stages.
So, and ultimately, I mean, finding vaccines that work and testing them and then mass producing them is necessary, right, before we get to sufficient immunization, I would assume. So you had mentioned, say, a year's timeline. Is that optimistic, like, you know, that we might be in a position to have a vaccine or multiple vaccines that can be mass produced in a year?
Well, I think a year, well, it's also, that depends on an accelerated approval process, and that there's been enough safety data that has accumulated for them. I think it's realistic to view that there'll be significant numbers of significant amounts of vaccine and significant numbers of doses of one or more vaccines available a year from now. Whether that's enough for the whole world's population is probably a pretty good question, and likely we're going to have to start with the highest risk groups when there's a small vaccine supply available to us as our Canadian share.
Right. So what kind of level of population immunization is necessary in order for us to have sort of relative security that we've got enough coverage from a virus like this?
Well, the level you need for herd immunity, which is that the fact that many people are protected, actually slows down the transmission in a population, and actually protects the people that actually haven't received either a vaccine or a previous infection. So that's what herd immunity is. Most of the numbers I've seen for coronavirus have talked about 60 to 70% of the population having immunity. And you get immunity either by being infected and your own natural immunity that your body has built up, or by receiving a vaccine and reacting to the vaccine and building up immunity because of having received that vaccine. The 60 or 70% isn't usually an all or none phenomenon either, though. The higher you get with the coverage, the less frequent you'll have outbreaks. So 90% is better than 80%. 80% is better than 70 or 60%. When you get down to 15 or 20%, you're probably just protecting the people that have received the vaccine and not the rest of the population.
Well, let me ask you about that then. So in the last few years, there's been limited but vocal public backlash against vaccines and skepticism, right? And I wonder to what extent the coronavirus pandemic may have begun to shift some of that, either in public opinion or maybe in the future in government policy around things like mandatory vaccinations, right? I mean, if we have something like this that puts all of us at risk and a vaccine is available, then there is an argument to be made that we have a public responsibility, I think, as individuals to take that seriously. Do you think we'll see some policy shifts or some public opinion shifts around the importance of vaccines because of everything we've been through?
Well, that'll be interesting to see. I think one of the reasons that a small percentage of people have, I forget what the real term, the sort of vaccine reluctance or something like that, is because in Canada, now the diseases that our immunization system protects against aren't very common. For instance, measles is a very rare disease in Canada, except in an occasional outbreak that might occur in groups that haven't been vaccinated. So we tend to, some people tend to see, worry about the side effects of vaccines, and they don't see the benefit of these diseases that aren't around anymore. Mm-hmm. Because of the vaccination programs that we've got. So there certainly has been a lot of publicity about coronavirus and the deaths from it. So I would think for a lot of people that'll make the risks seem clearer, I guess, and the benefit of preventing that risk should seem clearer as well. But we'll have to wait and see, you know. Yeah. You know, it certainly seems like, yeah, we'll have to just wait and see. Yep. Hopefully people will, this may be the first time where people have come across a disease that's fairly common and fairly significant in North America, and a way to protect against that. Mm-hmm. So hopefully they will take vaccines more seriously because of that. Yeah.
So that may be one thing, and this is the next question I wanted to ask. That might be one good thing that comes from this. So, you know, thinking about the longer term perspective, what are some good things that you can see coming from our collective experience dealing with this, and some things that may, you know, help improve our healthcare system or our society more generally? What are your initial perspectives on the good things that may emerge?
Well, I think there are actually. It would be interesting to sit some ordinary people down and see what they think of that very same question. I was just thinking, you know, when I've been outside walking around, there's just way more people outside walking and riding bikes. Yeah. One of our bike stores locally is sold out of bikes. Wow. Which is not something that happens to them every year. And we see people walking, you know, couples or small groups are out walking quite often, whereas in the past, the streets were really busy with cars, but you didn't see so many people out exercising together and enjoying being out in the fresh air, I guess. Mm-hmm. I wondered, you know, I mean, certainly our ability to contact other people that can be far away using Zoom or, you know, FaceTime or electronic means to bring people together who can't be together physically. I think that's a good thing. I have wondered whether, you know, some families, you know, having to spend all this time together, I think that should be good too. Although I'm sure it's not hard for a parent with young kids and they're trying to work at home. But I think that may be a remarkable experience that they'll be thinking back to for many decades.
No, that's very true. Yeah. Wonderful. Okay. Well, you know, Dr. Findlater, I don't have any more questions for you, but is there any messages or anything you'd like to leave our viewers thinking about just in your last comments here?
Well, I think just the idea that we've had a pretty easy time of it compared with Quebec or Ontario. But it hasn't gone away. It's not going to go away and not come back. Mm-hmm. So continue to be careful in the summer. I guess expect trouble in the fall, and expect that you have to behave a little bit differently than you did in the past, at least until we're able to get a little bit of this herd immunity that we've been talking about, you know, by next summer perhaps, or if there's a lot of vaccine available and people can get vaccinated, that's when you'll be able to ease up.
Mm-hmm. Okay, so stay vigilant. Well, thank you, Dr. Findlater, for taking the time to join us today. I really appreciate it. to our viewers. We'd love to hear from you about who we should be interviewing next. So please let us know, and you can access this information and all of our information related to these issues on our COVID web portal. Thanks everyone. Thanks Dr. Findlater. Take care. Have a great rest of your day.
Okay, bye for now.
Bye.